Miss Nick, my name is Brigid McGrath. I'm going to be your nurse today. How are you feeling today?
I'm well.
Well? Okay. Have you been feeling like anything bad in the past 2 weeks, or are you good?
No, I'm good. I'm feeling good.
Okay, good. How's your family? Any history of like hypertension?
No, nothing.
Diabetes? Anything?
Mm-mm.
Okay. Have you had any like allergic reactions to anything? Any allergies to food? Any kinds of medications?
No.
Okay. Have you been taking any medications lately?
No.
No over the counter, no prescription, nothing?
Mm-mm.
Okay. And have you had any recent hospitalizations, surgeries, any significant injuries?
No.
Okay, so you're good?
Yeah.
Okay, let's get started. Okay, the next thing we're going to do is your height and weight. So before you get on the scale, I'm going to ask you to take off your shoes and any heavy clothing that you have. Okay, sounds good. Can you please step on the scale? I'm just going to calibrate this real fast. Calibrate so it's correct. Okay, sounds good. Now please step off the scale real fast, just so this way it doesn't smack you in the head. Okay, now please step on. Okay, you may step off. 53 inches. Next step is to wash your hands, and I'm going to turn on the water. Not at a pace that's too fast, because then water's going to go flying everywhere. And at a nice, comfortable temperature, not too hot, not too cold. So I'm going to get my hands rinsed, nice and wet. Soap. When you're putting on soap, you want to be sure that you wash from the cleanest part of your hands, which is the wrist, to the dirtiest, to the fingers. So clean, clean, clean. You want to be sure to get in between your fingers. The most important part about hand washing is to get the friction in. If you wear rings, you want to get clean under there because bacteria can build up under there. You want to get under your nails and be washing for at least 20 seconds. So you just want to be sure that you really get all the friction in between everywhere. And then when you rinse off, same thing. You go from the cleanest part of your hand to the dirtiest part. And then when your hands are fully rinsed off, you just let them drip. You do not flick, even though it's tempting. You just let them drip, because if you flick, you can send the dirty water and bacteria everywhere. You get a new paper towel to dry your hands. And then once your hands are dry, you get a new paper towel to turn off the water and dispose of both paper towels. The next thing we're going to do is your temperature. Now, before I take your temperature, I'm going to ask you some questions. Have you had any caffeine lately in the past half hour?
No.
Have you exercised?
No.
Any food or drink?
No.
Okay. So can you please open your mouth? I'm going to put this under the sublingual gland. Now please close. Ding. Okay. 97.5, which is the normal temperature, which is between 96.4 and 99.1. Next, I'm going to take your radial pulse, so may I please see your arm? And I'm going to count for 30 seconds. Okay, so your pulse was 72, which is 72 beats per minute, which is within the normal limits of 60 and 100. The force was +2, the elasticity was spongy, and then when I put your arm over like this, I was actually counting your respirations, and I didn't want to tell you about it because I didn't want you to affect your breathing because you would be paying more attention to it. Your respiration rate was 12, which is also within the normal limits of 10 and 20. What we're going to do is I'm going to take your blood pressure, and I also want to be sure you're sitting in the right position. So can I have your right arm up and parallel with your heart, and your legs are also uncrossed, which is good. The next thing I'm going to do is be sure that the cuff is the appropriate size and line it up correctly at the brachial artery. And there it is. I want to be sure that the Velcro is completely covered and that there is about 20% left over. So there we go. I'm going to hook this onto her clothes. I'm going to use the diaphragm size of my stethoscope and insert it right in here. I'm going to feel for her pulse until I don't feel one anymore. And then I'm going to listen for the sounds. I'm pumping it up so I don't hear a sound till 130 or 30 more, and I'm going to let it out slowly. Okay. Your blood pressure was 112/76, which is within the normal limits, or like the gold standard of 120/80.